In general, I'm speaking even beyond COVID vaccines. WHO always asks governments to be cautious around the issue of mandatory vaccination, because in most situations, many people who are hesitant about taking vaccines have genuine questions that need to be answered. There's information they need to make a good decision. So the issue of vaccine mandates becomes an issue when a government or when a public health authority has a clear public health goal, which vaccine is required to reach that goal. If that goal cannot be reached because of a high level of people not wishing to take the vaccine, then sometimes governments are in a position where, in order to benefit society through reduced suffering and death, there is a need to bring in measures that incentivize people to take the vaccine, or in some cases have some requirement that a vaccine is taken or given. We have extensive guidance on that through our ethics group. It's very well laid out, and it really clearly states that all measures should have been taken in advance of a mandate to ensure that everyone is adequately informed, that people have the opportunity and time to be vaccinated, and that clearly the public health outcome and the social outcome and the population outcome of a mandate greatly outweighs the disruption to any individual right or any individual freedom. And that has to be carefully balanced. So, yes, there are circumstances in which vaccine mandates are supported by WHO, but it again is subject to the basic principle that the best way to get people vaccinated is to inform them, to educate, to have a dialogue, and address people's genuine concerns when it comes to information and knowledge about vaccination, especially for them, their families, their children, their parents, and community. So WHO's position, I think, is pretty clear. We see mandates as a last resort in the face, and we've seen, for example, in the last number of months with Delta and Omicron, in the face of a large epidemic in which we know that vaccines will save lives, and we know that vaccines are life-saving, some countries, having done all that they can to convince people to be vaccinated by any other means, feel that in order for schools, in order for workplaces to function, in order for transport to function, in order for society to function, and in order to save the maximum number of lives, they bring in mandates. We always ask that those mandates be clear, be explicit, be time limited, and at the same time to be accompanied by the appropriate risk communication and clarification, and the governments continue to explain to people why they're doing things and continue to try and convince people of the benefits of vaccine rather than reverting to mandates as a single approach. I'm sure Kate has something to say about this, but that will be WHO's principal position on this matter.